If you're like millions of Americans, the first few months of the year offer an ideal time to focus on your fitness. But what steps can you take to help achieve those health-related resolutions? Here to provide some tips, Dr. Rhonda Randall, Chief Medical Officer for UnitedHealthcare. Dr. Randall, why is the new year such a good time for people to focus on their well-being?
Thank you for having me. Well, we did a survey and we found that half of Americans made a New Year's resolution about improving their health. And that was things like losing weight, exercising more, or focusing on their mental well being. And we know that nearly half of those goal setters will drop off of their New Year's resolution, usually by the end of February. But we want to help with those efforts at United Healthcare. So, a good place to begin is with your health plan. Many people forget about health plan resources that can help you achieve your New Year's resolution goals.
Well, some people may think about their health care plan when they have an injury or an illness, but you're saying that your plan might help prevent issues before they start. How so?
Yeah, that's right. While your health plan may vary, most cover annual physical examinations and many preventative screenings. We're talking about things like mammograms, colon cancer screenings, most vaccines, for example. And I always recommend to take advantage of that. Start with your primary care doctor. And if you don't already have one, here to help you find one. And many more are offering those services virtually, which can be a very convenient way to access the system and get care.
So you mentioned virtual care. How can people use their health plan to connect with care providers remotely?
Virtual care has really surged in popularity in recent years, really helping people address things from what typically were urgent care issues in the past. Earaches, sore throat, stomach upset, for example. But there's more and more utilization for things like primary care, behavioral health needs, for example, treatment for migraines, physical therapy, women's health issues, sleep issues. More and more things are being covered and cared for through a virtual environment.
Well, that's great to hear. I know deductibles could be a barrier to care for many people. So what other strategies should people keep in mind to cover their deductible if needed?
That's a great question because half of Americans have a high deductible health plan. And one of the ways that you can help offset some of those costs is by doing things that are healthy for you and getting engaged in engagement and incentive programs. For example, we have a United Healthcare rewards program that you can earn dollars that can be spent on medical expenses for doing things like daily activity, walking 5 or 10,000 steps, getting your flu shot, getting your annual physical examination, tracking your sleep, stopping smoking, and more.
Any final tips to help people maintain or improve their well-being this year?
Yeah, we talked a lot about physical health, but don't forget those important exams like vision exams, dental exams, and getting your hearing checked if that's something. So, this is a good time of year to get those appointments scheduled. Most plans are going to cover several exams for dental cleanings and annual eye examination. And if hearing is a concern, certainly don't neglect to schedule that test to get your hearing evaluated.
It's a lot of great information, Dr. Randall. Where can people go to learn more?
You can get this and more information at uhc.com.